Hello and welcome to EMR Optimization for Cancer Screening, Accuro EMR. This video is part of training module number 3 and the topic is Using Tasks for Cancer Screening. Please take a moment to review our speaker disclosure slide. The objectives of this training video are to help Accuro users understand the purpose of tasks and how they work, learn how to manage tasks, and understand how to use the task report. If you recall from training module number 2, we talked about how searches are a tool for population-based screening in a typical cancer screening workflow. By contrast, tasks help us facilitate opportunistic screening. In this piece of the workflow, you start with patients getting screened. The results of the screening test come into the practice and are entered into the EMR. This leads to the manual creation of a new task, which informs providers when it's time for the patient to be screened once again. When clinicians are with a patient, they can see the outstanding task in the patient's chart, which will prompt the clinician to discuss screening. There are two ways of setting up tasks that you need to know about, globally and individually. Setting up a task globally is done as a follow-up step after generating a list of patients from search results. Globally applying a task is a way to quickly cover a large group of patients that are eligible for screening. Setting up a task individually is a bit different, as these tasks are applied on a patient-by-patient basis. It's useful to apply a task individually when a patient was either not covered by the globally applied task, or when the patient requires screening outside of the normal recall period. As mentioned, globally applied tasks are created using the results of your cancer screening searches. Let's take a closer look at how tasks are applied globally to patients' charts using the example of patients who are due for breast screening. Once you have run your breast cancer screening search and reviewed your results for accuracy, you can choose an option to apply a task to all the patients that were returned in the search. The task will become visible in the patient's charts and will show the task action that is required. This is a great way to set up the same task for a large group of people using minimal effort. So how do you set up a task individually? Well, unlike tasks that are applied globally, this has to be done on a patient-by-patient basis. This means that you would go into a patient's chart and manually set up specific tasks for only that patient. This can be helpful if you find an eligible patient that wasn't captured in a globally applied task, for example, a patient who has recently joined the practice. Individually applied tasks are also important for managing patients that have an increased or higher risk due to their medical history. Individually applied tasks can be tailored to meet their specific needs. Let's take a look at an example. Let's say a patient has a first-degree relative that has a history of colorectal cancer. According to Cancer Care Ontario's screening guidelines and recommendations, this patient would be at an increased risk for cancer and should be screened using a colonoscopy instead of a fecal occult blood test. The patient can be set up with an individually applied task that outlines the need to be screened using a colonoscopy. The due date for this procedure can be customized, and additional information can be recorded if necessary. So what happens to globally and individually applied tasks once they are in a patient's chart? During an encounter with a patient, a clinician will see that there's an outstanding task in the tracking module of the patient's chart. By clicking on the task, the clinician can view the relevant information needed to have a conversation with the patient about their screening needs. At this point, there are a couple things that can be done to manage the task based on the patient's response. For example, if the clinician discusses screening but the patient declines, a note can be added to the task reflecting the patient's decision. The task and the note will remain in the patient's task module. If the patient agrees to screening, the clinician will wait for the test results to come in and then will mark the task as completed. The completed task is also stored in the patient task module. As part of your screening workflow, after you have updated a task as being complete, you should immediately set up a new individually applied task for the patient, which will indicate when and how they need to be screened again. Anyone using the EMR can view tasks that are attached to a patient. This is helpful when discussions about screening are a responsibility that is shared among different members of the practice team. It's important to note that tasks are not automatically updated when a patient is screened. Tasks need to be manually created and updated by your practice team in order to keep them up to date and useful. Consistently applying and maintaining tasks allows you to take advantage of a very useful tool called the task report. This report will provide you with a list of every patient that has a specific task in their chart, regardless of whether that task was applied globally or individually. The task report indicates whether the task has been completed or whether the task is still outstanding for each patient. The report also provides any custom notes that were made for specific patients. Please note that the task report will not include tasks that are in the patient's task modules but not yet outstanding. To walk through an example, let's say you've applied tasks for breast screening. After a certain amount of time, maybe 3 months later, Some of these tasks have been updated. The report shows that some tasks have been completed and some have notes attached to them. Using the task report can be great if your practice is proactively calling patients in to get screened. If you're planning to contact all of your patients eligible for screening, you can save time by not calling the patients who you know have already gotten screened, or those who have refused the test. The task report can provide all of this information in one place. That takes us to the end of this training video. We have 4 additional training videos on the topic of tasks. The first 2 videos will show you demonstrations of how to set up globally applied tasks and individually applied tasks. The video after that will demonstrate how to manage tasks. And the last video in this module will show you a demonstration of how to run a task report. Before you move on, please take a moment to complete the short quiz to test what you've learned in this module. Thanks very much for watching.